I want you to make that face when he
Hold
says
on.
you're
All
live.
right, we are live. Welcome, everyone. 9:30 p.m. on Motzei Shabbos, Slichos night. As has been the minhag, the custom at Boker Ton Synagogue for the last number of years, we host every Slichos night a community conversation, an opportunity to hear from members of our community about pressing issues facing our generation, facing our day and age. And tonight we are talking about a very, very important topic, and that is COVID and its impact on mental health. I want to introduce and welcome all of our panelists to this conversation. First, to my directions are going to be different than all of yours, but first to introduce Rabbi Yaakov Sadiq, who's the new head of school at Katz Hillel Day School, Mrs. Rachel Mirzoff, who is a guidance counselor at Katz Yeshiva High School, Rebbitzin Eliza Blumenthal, who is a licensed social worker and is the Rebbitzin, or a satellite minyan, Boker Ton Synagogue West, and Rabbi Dr. Moshe Winograd, who is a therapist in our community as well. And I want to thank you all for being on our panel. I know there are a lot of things you could be doing on a Motzei Shabbos, and we appreciate with you sharing our wisdom with us here this evening. I want to introduce this topic, which is obviously a very relevant and in some ways a very difficult topic, with a few caveats. Number one is this conversation tonight is not meant to be clinical. It's advice for the average person, for the average parent, but no one should diagnose themselves or their friends based off this conversation. If you sense that based on this conversation, you are in need of professional help, get it. Nobody should base it solely on this conversation. Obviously, we are speaking in generic terms, and it's hard to speak to each individual case. But if there is something that you hear tonight that you say to yourself, that is something that I think needs to be addressed, or something that someone said speaks to you, we strongly encourage you to get the professional help that you need. I'll just share with you one statistic to open up our conversation. And that is an article that I read the other day, which said that in the 3 months following testing positive for COVID-19, 1 in 5 survivors were recorded as having a first-time diagnosis of anxiety, depression, or insomnia. So within 3 months of a diagnosis of COVID-19, 20% for the first time experienced anxiety, depression, and insomnia. And we, of course, know that those numbers are not really representative of what we've been seeing around us in the culture around us. People who've had their routines disrupted, their children's routines disrupted, their lives disrupted. Obviously, the anxiety that comes with a constant fear of health concerns, obviously the concerns of being homebound for so long and of getting sick. These are all the things that have been facing so many of us over the last number of months, for the last year and a half. And it's about time we discuss it, because we sit in kind of this balance between reflecting upon COVID, still going through COVID, and trying to come out of COVID. And I think it's important to reflect upon the lessons that we've learned about COVID-19, about its impact on our mental health. And so again, I want to thank all of the panelists for being here with us this evening, and for sharing your wisdom and your guidance, and really making yourselves vulnerable by sharing, again, both personally and professionally. So I want to start off. I'm going to ask each of you to just introduce yourselves. And if each of you could share just a little bit about your own personal COVID experience, we will start with you, Rebbitzin Eliza Blumenthal. Please introduce yourself and a little bit about your personal COVID experience.
Personal COVID experience. Cool. So I'm Rebbitzin Eliza Blumenthal. My personal COVID experience. So in general, in my professional life, I'm a social worker, a licensed clinical social worker, and I work with geriatrics. So COVID very much impacted my job and my clientele, because a lot of my clients have Parkinson's or different neurological disorders, and became homebound all of a sudden, had to stop a lot of their exercises. But on a personal level, as a mother, a Rebbitzin, as someone who was working during COVID, and trying to figure out how to balance all those things. And I was trying to figure out how to balance all those things before COVID. So COVID just sort of compounded figuring out how to do that. It was really hard. Honestly, I wasn't the nicest in the beginning. I feel like I was maybe yelling at my kids a little bit more because I wanted them to shush in the background of my Zoom therapies, because my husband was teaching in one room. I was doing therapy in another. Everyone's like, isn't it great? You're like with your husband more. I'm like, physically, if you GPSed us, we are in the same location, but we're never with each other because I'm in a session when he's not in class. And then we were switching. And then the pressure of making sure your kids are still getting their education. But I feel like this is a story a lot of people have that it's not so unique to us. So really forced us to figure out a lot about what wasn't working in our lives beforehand and what tools we needed, what boundaries we needed that had to be self-imposed instead of just waiting for some external thing to happen to make us be this amazing organized family or organized lives. And I found COVID, once I got over the initial shock of what was happening, to be a really, really inspiring learning experience for how I'm raising my kids and running my household, running my shul, and doing my practice. Still working on it, but I learned a lot.
Okay, thank you. We're obviously going to come back to some of those lessons, so I hope you're prepared with a
Sure.
follow-up question about that. But let's turn it over to Rabbi Dr. Moshe Winograd. If you can just introduce yourself a little bit and tell us about your personal COVID experience.
Sure. I've been living in Boca for 4 years at this point, loving it in Boca. Glad that if I have to be going through COVID, it's here. My professional experience, so I'm full-time in private practice. I'm kind of split between reproductive mental health issues and then also serious mental illness and substance abuse, particularly with people coming in and out of like higher levels of care, like residential treatment. I've been in private practice for a few years, and my private practice kind of took off right at the beginning of COVID. I don't think it was COVID related. I think it was just the amount of time I'd been in it. So I was actually pretty busy. I'd done a lot of online therapy before, so I was pretty comfortable working in that online space, albeit not with my kids quite in the background that they were. And in terms of myself personally, I think for me, the key has been to be flexible with what I feel like I need. So I jog, nothing like you, Rabbi Moskowitz. You put me to shame in terms of that. But I increased. I went from twice a week to 6 times a week in the beginning of COVID. I'm definitely not doing as much as at this point, but I did pick up violin lessons recently. So I've been kind of flexible in terms of what I feel like I need for myself. And then for me, like community learning has also been like a key way for me to stay grounded as well. So the Gemara that I've always had has kind of been particularly important, and coming back to shul has been very, very important for me as well.
Great, thank you. Before I turn it over to our next panelist, I just want to, for those who are listening, and thank God we have a nice audience, if you do have questions that you would like to be addressed, you could put them in the comments of either Facebook or YouTube. I will see them, and I'll be happy to direct them towards our panelists. Rebbitzin Reichi Mirzov, please.
Okay, so I'm Reichi Mirzov. I'm a guidance counselor here at Katz Yeshiva High School. I do have a small private practice. I guess I'm supposed to say that because it's true. And I love that, and it's great. And I love working here. This is my 6th year now working here, and I love it. So thinking about what COVID was for me, I guess I'm working on being vulnerable. This is my new thing. So I love that I'm on this panel, and I love this is the first question. Something that is really hard for me is that I always think that I have to look like I have it all together. I've been struggling with this, I think, my whole life. I have it all together. I have a full-time job. I have kids. I have a husband. I have, I work so hard, but don't worry, I could still have a nice Shabbos meal and a clean house. And I got it. I got it. I'm a little bit of like a perfectionist in that way. And I really did not have it over COVID. It wasn't just that like my house was a mess or my kids were a mess or my husband needed things or I needed things. I really needed to ask for help. And it was the first time in a long time that I really needed to do that on a constant basis. And it was a struggle. It still is a struggle. But I'm grateful that I almost had this opportunity now of like almost a year and a half to really practice that, asking for help. I know that seems simple, but it's really was my journey of COVID, asking for help and admitting that I need it. So That was that.
Thank you. Rabbi Sadiq, please.
So I'm Yaakov Sadiq, the head of school, newly appointed head of school at KHDS. So far loving it here in Florida, and it's amazing to be down here. For me, COVID was difficult on two levels. Number one, our family got COVID. So I was in bed for 3 weeks because our school had a breakout an outbreak, where it closed our school down for a month. So, for the kids, they look to us as the leaders, the strong ones, and we're going to keep it going. And here, like, the whole administration has COVID and teachers have COVID, and like, what do you do? How are you machazik them, knowing that they're so fragile? So thank God, we got through it. And once I got my family in order and gave ourselves chizik, it was our job to come back to school and kind of put the pieces back together. And, we did so many things where we just, was with a lot of smiles and simcha and happiness. And, when they were in the school, I felt like they were on the teva or in the teva, where we made them forget about the world. So that was a tall order and a tall task. And I think we did it well. We were able to kind of take their minds off of it, a lot of transparency. And of course, they knew what was going on. But I think in those 8 hours that they were in school, we were doing our utmost to make sure that they're not distracted and they're learning and they're back to seeing their friends and socializing. And of course, which will be discussed soon, giving them all the resources that's necessary for compensating for the anxiety and everything that they were going through. So that was the two sides. Personally, we were affected by it. So we were kind of trying to deal with that. And then having to run a school and be the captain and make sure that you come in and check it at the door was quite a challenge, but I think we did a good job.
Okay, thank you all for introducing yourselves, and again for your very personal take on how COVID has impacted you. There are a million different directions that we plan on taking this conversation with, and it's hard to decide where to start. But I wanted to start with the notion of anxiety and fears, because I think so much of what has impacted so many people is the anxiety. Right? It's the anxiety from a health perspective. It's the anxiety and fears of whether your children are going to fall behind and the impact that it's going to have on them long term. The last year and a half was really defined by anxiety and fear. What are some suggestions you would give to people to help them with that anxiety and the fears? And particularly, I want to ask the question from a perspective of Emunah, right? Obviously, we as Jews believe in Hashem, and we believe that everything comes from Hashem, and that's supposed to give us a little bit more comfort during difficult times. How do you balance the notion of Emunah with giving suggestions for anxiety and fears in a very real, practical way that both validates what they're going through, but also gives them the strength and gives them the chizuk that they'll be able to come out on the other end? So, Rachel, if we could start with you on this question.
Yeah, of course. Thank you. That means I can't feed off other people's answers. Okay, right. Thank you. So that's a good question. And I think you asked really two questions in one, if that's okay.
Correct.
The first question, which is, the anxiety we feel about our kids and, falling behind and how it impacts them. I had the privilege to work in Camp Morashah this summer. And the director of the camp, Jeremy Joseph, put out an email right before Shabbos. And he's been the director now for 10 years. And it was a long email. Sorry, Jeremy, if you're listening. I read it. But there was something very, very, like 2 lines that I took with me, and it was unbelievable. He said that out of his 10 years of being the director of camp, this was the first summer that the youngest 2 divisions, which I can attest to because I'm the division head, the youngest 2 divisions, no one went home for homesickness. Not one kid. And he continued to say that the parents before the summer were so anxious. How are my kids going to adapt to being together again? How are they going to do that? They've been separated and isolated and masked. How are they going to learn the social skills that they need? And he just wrote, your kids got it. They have it. They're okay. Your anxieties are your anxieties, and keep them to you, and try your hardest not to project them onto your kids. So the first thing I would say is just self-check and make sure that what we're anxious about our kids are really because they deserve our anxiety for them. Or it could just be our own anxieties that we have to learn to deal with and work through on our own and not project them onto our kids. And just to answer about the Emunah piece, that really is a better question, I guess, for my husband. But I think in general, and I still, sorry, Rabbi Goldberg, I still quote you all the time of the let go, let God. And just to go back, I gave birth in the beginning of COVID to our youngest son, Penny. And I remember, now that you guys, I guess, get to know me a little bit more, I had a whole plan. Okay, we're going to have a nurse and we're going to have this and everything's going to be set and all the food was already in my freezer. And none of that worked out. None of it worked out in the beginning. I was so anxious, but what are we going to do with the other kids? And we don't have a babysitter to watch them because of COVID. And the minute I just said, I'm out of control here, like hands up, I'm done. You got this. I trust you, as hard as that is. And I still think it is so hard. For some reason, it's so liberating. I trust you. I don't got it. And I guess if I look at that as Emunah, I don't know if that's, as somebody else, but for me, that's how I got through, and, just to release yourself to him almost.
Thank you. I'm going to direct that question to two of our other panelists, but first I want to ask a follow-up to Rabbi Sadiq. Rabbi Sadiq, Rachel mentioned the difference between how parents experience the anxiety of COVID versus the children, that sometimes parents projected on the children, and the children are a lot more resilient than we give them credit for. So I'm curious for your perspective on that. Obviously, as a head of school, you deal with children all the time. What has surprised you most about our children? Are they more resilient than we give them credit for? In what ways can we be helping them more to deal with the anxiety and the uncertainty of COVID? Or should we just let them be, and most of them, by and large, will figure it out?
It's a great question. At Mincha, before Mincha time, we had a panel discussion at BRS West. And I mentioned there that, this is new for our children in America, but for hundreds of years, if not thousands of years, children had to be educated through wars, pogroms, plagues. Thank God we've been safe here in America, other than 9/11 or things that happened in Eretz Yisrael that rattles the kids. They've been able to have, they've been able to be protected and be able to have education without interruptions. I mean, I missed a whole year of school running away from Iran. So when I got here, I missed third grade. So can you imagine, as parents, we missed one day of math and we're like fainting. I didn't have math for a whole year, and I like to think I still turned out okay. So the point is that I look to my father's face. My father was in a Muslim school. He just can read the siddur. He never learned anything. I myself was in a Muslim school until I got here. So, I just, the things that my father has taught me, no Rebbe or Gemara has taught me, because he went from having a corner office working for a prestigious family that was very close to the Shah to standing on as I mentioned this afternoon, standing on the assembly line at Armatron and assembling watches for $3.25 an hour. And I kept looking at him, and he smiled, he came home happy, he kept all his anxieties in check. And he didn't speak the language. And I think I fed off of that. My father kept saying, well, we're living in Greece now. Dad, like, what are we doing in Athens here? Oh, we're just going to be here for a couple of months, and we're waiting to get a visa, and then we're going to go to Israel. And then from Israel, we're going to get a visa to go to America. Like, he could have been falling apart. He goes, you think I know what we're doing here in Athens? I didn't know it was going to. He just kept it together, and we all fed off of him. So what I see is the same thing. I think, when there's a lot of discussions about masks and not masks, the kids come to school and they're talking about it. They're feeding off of, those energies. And we do everything we can to, keep them laser focused. So by nature, just to get back, Rabbi Moskowitz, I think by nature, kids are extremely resilient. And they do better than us. I think we're nervous. They're fine. They bounce off. They're okay. They're good. So I think we should take that fact that Hashem has made them this way, made them resilient, and build upon it and make them even more resilient, acknowledge their fears, they're real, be transparent on the age level, of course, on every kid's age level. But again, for hundreds, if not thousands of years, kids were educated through crazy times. So it can be done. It's not ideal. It definitely stinks. But I think it can be done, and thank God Hashem makes them resilient. So there's what to work with.
Okay, thank you. Rebbitzin Elisa Blumenthal, I'm going to turn it over to you now, because I want to combine Rachel's answer with Rabbi Sadiq's answer. Rachel spoke about Emunah, about letting go, about some of those anxieties and fears. And Rabbi Sadiq reaffirmed that so much of that is because of us, and that our children are a lot more resilient than we think they are. Some parents might hear that and say, well, how do I shield my children from my insecurities? How do I shield my children from my anxieties? That might just make me feel even worse as a parent, because I'm getting all worked up over COVID, and maybe I'm harming my children more than I need to be. So what advice would you give to the mom, the dad who's listening to this, who just heard that answer and said, all the talking about masks and all the way that I thought I was protecting my children, maybe I was just making them more anxious, and maybe I was giving them additional fears, and maybe I should just, if I were a better person and I smiled a little bit more, they'd be better off. So what chizuk would you give to young mom and dad listening to those responses?
Such a great question, because I wouldn't necessarily use the word shield, because then again, that's covering over like what Rachel was sharing earlier before about being vulnerable. I think it's okay for our kids to see our vulnerabilities and for us to be honest about them. For many years before I came down to Boca, I was doing work around sexual abuse in the Orthodox community. And we were teaching elementary school kids about safety and all that. And we were teaching parents how to talk to their kids about such uncomfortable topics. And they're like, well, how can I say these words around them? Like, kids have no previous knowledge of these kinds of topics. Everything, the impression that they get about any particular topic, forget just about like something like sexual abuse, about COVID, it comes from you a lot of the times, which I'm not helping with the anxiety part of, oh my God, what am I doing to my children? Because I went through a lot of that in the beginning of COVID. That's what I suffered with, was how am I destroying them? And how can I afford their therapy bills from what I'm doing to them? But that's what I've learned, is that when kids have questions and I'm not quite sure what the answers are supposed to be or are, which is basically parenting, have to be honest, especially with an oldest child, because I always call her my guinea pig child, because I just feel bad because she's getting all my experiments. If they ask me an honest question, how I'm feeling about COVID, what's going on with me, mommy's a little nervous because of this. Like, I always like talk that out with my kids and discuss it with them. And I try and be an honest one, because even if I was lying or just not being super open, I don't know how I'd keep track of that, like with which kid I told what, that's my philosophy. I don't know if it's a philosophy or just my personality, is that I'm not great at hiding my feelings. I kind of say how it is. So if my kids are nervous or about COVID, it's probably coming from me, especially when we were all on lockdown for so long. And like, our family also had COVID. So we spent 30 days together. That was real great parenting, I'm sure, during my part. Thank you, Netflix. But regarding to chizuk for shielding your children from our anxieties, I think step one, and I think Rachel touched upon this also, is checking in with ourselves and trying to figure out, not to mask, not to cover up what we're feeling, but to really stop having guilt and stop self-blaming and hurting ourselves, and say it's okay to feel what we actually feel. It's okay to stop denying it. Because if we keep pushing that down, our anxiety is going to come out in one way. You're going to end up yelling at your child. You're going to end up eating something you don't want to eat. By denying how we're actually feeling about things, we're going to do something we regret in one way or another, whether it's a public thing or just something we're finding that we're in a closet at 12 a.m. having a midnight snack that we don't quite need, but we do feel like we need because we're anxious and uncomfortable. And I think it's okay to share these honest things with our children, especially when we don't know what we're doing, especially when we're not quite sure how we're feeling, because it also shows them that they don't have to be perfect to identify what they're feeling. And if they're going through something with anxiety, that they can develop it with us. They don't have to have this perfect answer ready to tell people to identify why they're feeling anxious. Could just be, are you feeling it in your tummy? Yeah, I don't know why, from extent all the way to teenagers who are definitely calling us out on our things. And I mean, my 9-year-old, she's only 9 and I'm so afraid of teenager life, but she calls me out on things all the time. But mommy, you said X, Y, Z. I'm like, you're right. Like, I'm okay with them pointing out when I'm doing that. I just have to own it and be comfortable when I don't know what I'm talking about, or I haven't quite concretized how I'm feeling about something because I'm in the middle of going through it. And as much as like I saw the topic tonight and I was like, are we still in it? Like, is that still happening? Because I don't always feel the way, but sometimes I have to wear a mask and sometimes, and it's just so confusing. And I'm like, no, we are. It's still so confusing. And it almost makes it worse to not know, are we in it, are we not? Because then we're just in fluctuation and we don't have stability to grab on. Like when we were in lockdown, we were in lockdown. When we're not in lockdown, we were not in lockdown. Now we're in this weird place. We have to sort that out. And kids feel that from us. They feel it from their teachers. They feel it from the bus driver if they take the bus, you know? So I think just forget about shielding our kids, be open with them, and as honest as obviously based on their age level. You have to like make sure you're not sharing too much with someone who's too young, but especially for our teenagers, they really need to see us being honest with ourselves so they know it's okay to not know and not be sure. And then you can have a conversation about it.
Thank you. I want to bring.
I'm sorry, Reverend, can I just clarify something? I'm sorry.
Yeah, of course, please.
When I said shielding, my father was very upfront with us. He told us we're not going back to Iran. You know, like we're not going to have that life again. Like this is it. What I meant was that he, as a mentor and as the father, he stepped in because I want to follow up on Reverend Bloom.
All right, I was taking that from my Oscar.
No, she's absolutely right. They were very honest with me with what was going on, that we're going to struggle financially and it's not going to be easy. We're not going to be able to buy you certain things for a while. And, but what I meant was he stepped in to be the one to get us through it. But I don't mean that he was hiding things from us or even his emotions were very apparent, that he went from the state of life that he was in to where he is now. So absolutely, I don't think those things should be kept, hidden. But he talked about it, but then was mechazek us. That's what I meant.
Thank you. I want to bring Dr. Winograd in for a second. First of all, just your thoughts about the previous conversation. And then also I want to take it to the next level, which is we've been talking about fear. We've been talking about anxiety. What are some of the signs that a person should look for of when it's like, oh, I'm anxious to, oh, I'm anxious, right? Knows at what point does a person, should they seek outside help? Should they speak to a professional? How do they know if they could deal with it internally? And maybe what are even some signs that they might not be aware of that would indicate that you're having a problem coping in this environment that someone can now be looking for to get the help that might be able to assist them?
Sure. Just so in terms of the previous thing, I have found that one of the more helpful things with my clients is it's like a mini intervention that comes from ACT-based therapy, acceptance and commitment therapy. And it's a more extended thing, but the most helpful part I've found is the protocol is called Face COVID, and the F is for focus on what's in your control. And we so love being in control or thinking that we are in control of our lives, and we aren't, but we often have the illusion that we are. And COVID's really thrown that through a real loop, but including this intermediate stage where sometimes it's this way, sometimes it's not. And being able to just drill down, smaller and smaller and smaller until you find that one part that you're actually in control over, to me, I think has been very helpful. And the metaphor that, ACT uses is like a ship in harbor. So when there's a storm, the ship's going to drop anchor. Doesn't change the storm. The storm's still coming and it's still going to bob the ship around. But when you're able to drop anchor, that minimizes the way you're going to be impacted by the storm that's around you. So for each person that plays out differently in terms of like the clinical work, but that piece has been very helpful. And I think to me that also ties in, at least for me, the Emunah side of this, which is about hishtadlus. I think that, at the core, we're only responsible for the hishtadlus piece of what we do. It's not always linear in terms of the hishtadlus I do and the effort I put into something and what's supposed to happen with my life. And if I can get better at figuring out what I am in control over in these current times, and then if I can execute that, then that is the hishtadlus I'm supposed to do. And even if it doesn't seem like it's going to add up to where we need to get to, that's on God. That's the rest of that's really up to Him to be able to make work out. In terms of the next part, in terms of like signs and symptoms of what's going on, and when it might be time to get more help for that. I think one of the most practical ways is to look at is X, Y, and Z actually causing a problem in my life? So we look at like level of functionality. What am I supposed to do, whether it's in my role as a parent, in my role as a professional, maybe in my role as a community member, my own life in terms of my health, etc. And how am I able to do that? To me, before we get into like any technical mental health definitions for any particular type of disorder, to me, it really often just boils down in terms of functionality. Sometimes I work with very wealthy people who have some pretty serious mental illness. It just hasn't impacted their life that much because nobody ever expected them to hold a job. They couldn't for the life of them, but that's kind of okay. And so we have to look elsewhere to see if this mental illness is causing a problem in their lives. Whereas for somebody that's, maybe a single mom working 2 jobs, well, that's a pretty big deal if they can't function at that job setting. So I think that, like a layperson's test should often be, when is this interfering with what I could, should, or want to be doing with my life? There's a tremendous amount of material available out there, whether it's in the self-help genre. There's a new book every month. There's nothing wrong with self-help books if you can make it work. Most of them have some really amazing ideas. I freely read a lot of them myself. They're awesome. I also know that I struggle to kind of put them into play. But there's nothing wrong with the ideas that they typically present. In terms of like what kind of outside help a person might need in terms of being able to make it work, I have friendly competition as a psychologist in the world of life coaches of all different sorts. Again, there's nothing wrong with them necessarily either if they can help you execute, I want to be able to put X, Y, and Z into place. And if I'm finding it helpful for whatever's going on for me, that's okay as well. If those things are not helping, then I think that's when I would say it's time to see a mental health professional. There's a whole range out there: psychologists, social workers, mental health counselors, psychiatrists. Some people, there's certain mental health issues that, from my vantage point, absolutely need medication in addition to therapy. Like I wouldn't see such a patient if they weren't on a sort of medication. But when we're talking about anxiety and depression, which is the more common things we see, I don't typically insist that a patient be on medication. I walk them through what their options are. They're not yet on it and they want it. And I work very closely with psychiatrists or primary physicians that would prescribe it. But I don't typically require that. I just make sure that they're aware of that as an option. In terms of therapy, there's many different types. I do my type and lots of other people do different types. There's no specific type necessarily that's objectively better. A lot of it's really about a fit in terms of the patient and the therapist, and also the type of the therapy for the patient. But I would really say it comes down to when it's causing a problem, when it's impacting your functionality. To me, that's the minimum. And then there's also people that are more introspective, reflective. They kind of want to know what's going on in their life, and they've been functional. They're going to work. They're going through all emotions just fine. And also they're wanting to understand themselves better as a person in the context of what might be coming up for them. And so there's another type of therapy that people can do where it's more reflective. It's less about, can I, get out of bed in the morning? And that can be very impactful too for people.
Thank you. That was actually very helpful. I want to ask you, Rebbetzin Blumenthal, a question, and then I want to come back to Mrs. Murzov and Rabbi Tzaddik with a different question. Do you think that this has helped reduce the stigma about mental health challenges? Do you think the fact that everyone's kind of going through something together and that everyone's experiencing fear and anxiety and a little bit of different diagnoses together, that it's helped reduce the stigma in general in society? Or has it made it more challenging for mental health professionals because now people are throwing around terms in a non-clinical way and it's kind of a little bit more jumbled than it probably should be?
That's a great question. Honestly, I don't know about reducing the stigma. The accessibility of therapy right now is greater. I mean, you need to make sure that you're accessing the proper people, because I know that every Joe Schmo gets an advertisement for online therapy and join us now. And it's so simple. That is something, like, I know I work a lot through Medicare. And for Medicare to be okay with a Zoom call, to be able to do telehealth, that was not something I was comfortable with before, because I wasn't sure how acceptable that was. So the idea that therapy is more accessible now is huge. Also, I think it does help reduce the stigma in that you don't have to get in your car and drive somewhere. You can do it from the privacy of your own home, but that also opens up to a whole lot of things, because now I find myself, I'm doing dual. I'm doing both online and I'm seeing people in person. So accessibility has made, I know a lot of people I know that weren't so into therapy before, more willing to try it out because it wasn't as much of a commitment because they didn't have to drive somewhere and figure out all that stuff, what to wear, how to be. Although that comes with its own things. At the same time, I do think COVID has helped people open up about what's going on, because when they're hearing what other people are suffering with as well, because that became okay to say, because we're all suffering, we're all going through it, that people, I feel like, were a little bit more open about what was going on in their personal lives. So I think just in general, that opened up the stigma a little bit more. Did it do it that much? I'm not sure. Because I think that still living in our not accessing other people like through Facebook and social media, and that things still got a little bit colored, like through rose glasses, what you're putting up, what you're presenting. Like it's always possible for people to put up a front, to be honest, and make it just exactly what Rachel was saying before of like, it took her to a point where she wasn't doing that. And some people did hit their breaking point, but then just got off and isolated themselves. So then there wasn't anyone else breaking that cycle of self-talk of, I should be able to handle this. I should be able to handle this. It was almost like it isolated them from the world. So they didn't know that they were in a place that they should ask for help because they were so in their own heads. They weren't socializing with other people or figuring out those things. So it's honestly, I don't know if it's changed it. I think it might just have changed how different people are viewing it at this point.
Dr. Winograd, what do you think about the question? Have we reduced the stigma? Have we made it easier for people to access resources that they need?
Yes and no. Online therapy certainly exploded. It's been interesting to watch a field that's been pretty resistant to online therapy for years suddenly just have no choice overnight. I don't think it's the same. It certainly helps a lot of people access it. I don't think it is quite the same. It might also depend on the type of therapy that you do. I do also know that in the world of substance abuse, this has been a huge problem though, because, you know, for example, like needle exchange programs have been shut down, AA meetings switching to virtual have really not been quite the same experience for people, especially people, you know, I work a lot of times with psychotic patients, you know, they cannot handle that kind of online environment in the same kind of way. And I think that part's really been tragic in terms of, you know, accessibility for, I'd say, high functioning therapy has greatly increased. And certainly long-term will be benefits that we now know that online therapy is a thing. We're going to find ways to make it better and better. But I think in terms of more serious mental illness, it's really been a huge, huge setback, including the socialization that for a lot of these people is really critical.
Right. All right. Thank you. I want to change focus a little bit. Ms. Murzov, we're going to direct this one to you. And I want to speak to you and Rabbi Sadiq. You work obviously in a high school. Rabbi Sadiq is in elementary school. And I want to talk about technology and the impact that the shift to so much technology has had both on us and on our children. There was an article either in the New York Times or the Wall Street Journal last week that parents were hoping that as we were coming out of COVID, so the onslaught of technological use that their children had during the pandemic would slowly revert back to the norm. And that parents were getting frustrated because that was not happening, that all of the technology that their children were introduced to throughout COVID, either because they were on Zoom school or because they want to interact with their friends, it's just not going back to normal. And we're seeing an increased usage of technology. What advice do you have to parents and to ourselves, honestly, about monitoring and controlling technology, and how can we better monitor its impact on our children?
Okay. I don't think this is going to be a popular answer, so I'm sorry, and feel free, everyone, to disagree with me on this one. I definitely think children are resilient, 100%. What they really sometimes have a challenge with is going back, right? They're good at being resilient, you know, working through it, getting through it. But now that they've reached that, asking them to go back to normal is actually not really such a fair request, because they've learned to adapt. They've had privileges that, in all honesty, they never had before. They were in their room with a computer, with the door closed for hours on end, doing schoolwork, doing what they needed to do, and they had no socialization, so they had a longer time on their phones. This was their only way to contact their friends, and they had all this like amazing technology, like free-for-all. And now we're saying like, okay, guys, we're starting to get back to normal society. We have to go back. And what I'm seeing, and I love teenagers. I work with them all day, but I think they're not understanding that concept. I think, what do you mean we go back to normal? This is working for us. We made it work. We've suffered the consequences, and now leave me alone. And what I'm actually hearing from parents is that when they try to put limitations or boundaries on the technology now, the kids actually respond with, that decision is affecting my mental health. It's affecting my mental health. I just want to like put it out there, and then this is maybe where I'm like wrong. Our kids are really smart. They're really, really smart. And more than that, they know a lot more than we know, a lot. And they learned how to figure this out without the boundaries in place. And so my recommendation really would be, remind them, not in a scary, mean way, but that you are the person that puts boundaries on what is best or what you feel is best for them. They're not used to that. They're not. They haven't had boundaries in a long time, especially around technology. And I think it's an important boundary to reinstate. And don't be scared. Don't be scared. I know it's scary, but I would put your big boy pants on and go for it on this one. That's my opinion.
So before I turn it over, Rabbi Sadiq, I just want to push a little bit. First of all, thank you for your answer. What would you tell the child, though, whose primary means of communicating with his or her friend is texting, right? Mm-hmm. So you might say, I need to put boundaries, and they'll say, yeah, but you still want me to communicate with friends. I may or may not be doing play dates as normal. I want to talk to my friends. I want to be on my phone the whole time because I don't want to miss out on the conversation. I don't want to miss out on where the play date is this Shabbos or where everyone's getting together this Sunday. So, your child's going to push back at you and say, well, what do you expect? Like, my entire means of communication is this device. And now all of a sudden you're asking me to basically self-regulate, how much I'm on it, how much I'm affected by it, how much I'm seeing once I'm on it. So what do you tell a teenager then?
I mean, I think the boundary has to be obviously a reasonable boundary. We're not taking away the phone and being like, forget it, cold turkey, no more. I remember when we tried to do that with our kids and their iPads, I'm like, that doesn't really necessarily work. It has to be in moderation. And I also think kids need explanations. Like, they need to understand where this boundary is coming from. So if you say to a kid, I understand that this is the way you socialize. I understand that this is the way you have until 9:00 at night to make your plans, to talk to your friends. I love you. You need a good night's sleep. That's okay. I'm doing that because I love you. They might hate you. Okay. They're going to love you again. And to the kid who comes in here and complains about their parents being so mean because they took away their phone, I always say, like, you do know that they're doing it for your own good, and they say usually yes. They know. It's just frustrating. We do hard things sometimes that are hard and that don't feel good. Nobody likes to get a shot at a doctor's office, but it's for your benefit. And I think in particular with technology, I'm not going to say this about everything, but with technology, you have to be so careful. I did this project last year. Shout out to any of my girls that are watching. We did, if you deleted TikTok, which is an app, if you deleted TikTok during finals week, I gave you an extra point, like on your final grade. Sorry, Rabbi, I love it. So it was amazing. Why? The girls realized that in 1 week, the amount of hours that they were on just this one app, TikTok, was 72 hours in 1 week. 72 hours. So during finals, they got 72 hours back to study for finals, talk to friends, do whatever they wanted to do. And I just think they don't realize how technology affects them until somebody really shows them, like, look what it does to you. And it's not necessarily a bad thing. There's great things about it, but they don't always see the effects of it.
Thank you. That was excellent. Rabbi Sadiq, you obviously deal with a younger population in your professional work, but even at a younger ages now, the kids are coming home with laptops. They're doing their schoolwork on their laptops primarily, certainly in some of the schools. And obviously that creates challenges for parents. And as parents try to walk that back, kids are sometimes like, whoa, wait a second, I've been enjoying this computer. What advice do you have for parents for how to regulate, create those boundaries, and create a healthy relationship with technology?
Yeah, good question. I'm going to take a little bit of a different angle than Mrs. Mirzoff, and I'll tell you why. These things that came about, the challenges with technology, were there way, we know that were there way before COVID. Fortnite was not a product of COVID. Children were spending 7 to 8 hours on Fortnite, and the technology that was offered during COVID was primarily for school. And of course, it got them more in front of the screens, and it wasn't healthy for them. And we read the studies of what is done for them. But in my studies and research, I found that on the other side, there were children all of a sudden picked up books, and because they didn't want to be on Zoom school for 9 hours. There's a shortage of bikes. You can't find a bicycle because kids who never rode bikes started biking. The neighbor of mine, he said, I can't get my son to ride a bike. I was like, what do you mean? It's a rite of passage. Like every kid has to ride a bike. He goes, no, he doesn't care for it. He's on his phone and on his, Xbox all day, and he couldn't care less for riding a bike. Well, during COVID, he learned how to ride a bike. There were girls learning how to bake and doing all sorts of amazing things and collaborating on Zoom. So there were positives there as well. I think the technology issue is a technology issue with or without Zoom. So today in the afternoon, I mentioned that one of my favorite pieces on Pashas Kedoshim is Chassam Sofer. And when he talks about Kedoshim Tiyu, he says, why was it said in Kahal and everybody had to be there? Because we were afraid that, when Rashi says precious, like you have to, keep yourself in a bubble, run away from it. People would run into the woods to live out there, so they wouldn't speak Lashon Hara or see things they shouldn't see. And Chassam Sofer just the opposite. You brought the whole nation to say, B'tocha mitecha. I want you to be holy while living in this world. We live in this world, and technology is a real problem. I think, healthy conversations, as it's been brought up by the mental health people here, is very important. I mentioned before earlier today, my son runs right to my wife. If something pops up on his phone that makes him feel uncomfortable, that's something that we cultivated in our home. But I don't think this is going away. And I think that the stories that I heard from parents who took a hard stand and smashed phones and put it in safes with codes and all that stuff just backfired. It created more resentment, in those children. I think the healthy way is to allow them to have a phone. I don't know at what age. That's up to every parent to decide. But, with filters and with checking in and with transparency and with, coming to mom and dad when you've seen something that you're uncomfortable about, or a friend has posted something. I have my daughters who always leave chats all the time. They say there are things being posted in the WhatsApp chat that I'm just not comfortable about. It's not how we were raised. And it's something that we take a lot of pride in. I've had to leave chats where things were getting risque in there and I wasn't comfortable. So I think just like anything else, we teach them to use it, but how to use it. But, in every bad, there's good. There's some good that came out of COVID where children decided to do things that they never do. The fact that we started having dinners together and, the beautiful Seder we had, even though it was sad during COVID when we were shut down. I think I found out that I had kids that I didn't know that I had. So there were positives there, but I think technology is an issue regardless. I don't think the math problems that they're doing at home or all these curriculums today that come with a tech component, they're not the issues. The issues are TikTok and everything else that they're involved in. And I think we need to figure it out. Every family has to figure out how they want to handle that.
We're going to come back to, you mentioned some of the positives, and obviously many of us have experienced some of those positives. I want to come back to that in a second, but beforehand, I want to do a lightning round. We're going to break this up a little bit. If each of the panelists can share either an app or a filter that they use in their personal lives or that they recommend for parents to be able to guide them in how better to monitor and create boundaries in technology use. We will start with Rebbitzin Blumenthal. Lightning round. One app, technique, or filter that you use in your house?
One thing that we do have is what is my husband's trying to show me here. Yeah, I know. That's it. I have the same filter as you. Thank you. Um, Disney Circle. He's like trying to show me. I'm like, I know the name. Disney Circle is actually one that we have because it can put all the iPads and apps connected to both my husband and my phone, and we have access to it. We can pause it from our phone. We can control a lot of things. We can also control how long someone's using, or if someone does something which warrants that they get extended time, or if they get something that reduces time, because it will shut down their iPad. It won't turn off the iPad, but like Wi-Fi access of that nature. I find Disney Circle to be very user friendly.
Excellent. Dr. Winograd.
Yeah, we don't have any particular app. I'm a Talmud of Rav Willig, and he always had this idea about not having yichud with the computer. So we basically don't allow them to use any devices and like really on their own or in a locked room or anything like that. And also no kid kind of has their own device. My daughter thinks she has their own device, but it gets shared pretty frequently.
Okay, Mrs. Mirzoff.
Yeah, sorry. This is why, Dr. Winograd, we don't let our kids in their room alone but they're little. My kids are little. That won't necessarily work with teens. But yeah, I don't have an answer. Sorry.
Rabbi Sadiq.
As usual, I have no idea what goes on with my kids. I have to put in a call to my wife. But I think my wife has worked out through Verizon, where she has access to all their phones, and something 360, where she knows where they are and she could track them. But we're very good about it. We don't do it, unless we feel there's something going on and they're off or there's stuff in class that's been going on. Because again, we've worked very hard to cultivate a relationship with them, that they come to us. But I do believe my wife, through Verizon, has access to all their phones, if need be. So that's a security blanket that we have. So
it's one thing that I want to highlight as we wrap up this part of the conversation is almost all of the panelists that answered the question about technology. Just to be clear, if I could speak on your behalves, but it's not about one app. It's not about one filter. It's about creating an environment in your house. It's about engaging your children in the conversation. It's about really creating a sense of partnership between you and your children, where there's an open dialogue about the challenges of technology, the challenges of social media, the benefits of it, and how to have a healthy relationship with usage, whether it's of technology or social media. I just want to reiterate that point because we've heard it. We've had Dr. Eli Shapiro, both in our show and on Behind the Beam in the past, and he feels very strongly about that it's not just about one filter, but it's about creating a culture of responsible usage of technology. And again, I know he has a wonderful organization if people want to see more about that over there. Dr. Winograd, I want to turn over to you right now, and I want to talk a little bit about OCD. Not OCD necessarily in a clinical sense, but OCD in the way that it has affected people's relationship with COVID. People who may have had a certain tendency towards washing hands, or a fear of germs, or a fear of getting sick. Now that's been exacerbated, of course, by the concerns of COVID. How do you help people as we're trying to emerge out of COVID, and there's that persistent fear of germs, of catching something, of when I touch a doorknob? How would you help guide a person through those fears of, again, not a clinical OCD, but the conquering the fears of germs, not excessively washing hands? Do you see that in your practice? What type of advice do you have for people who are grappling with that?
Yeah, anecdotally, it seems that people with OCD during the pandemic have actually fared better. I think because a lot of it has been normalized, that there are real germs. It's not just in my head. In terms of this phenomenon of how we're coming out of it, I noticed for myself that, touching people has been something I'm still very conscious of it. Like when somebody will touch me, I'll do a mental double check, was that okay? Where did this take place and how long and all of that? I think the challenge now is that we're kind of at the, I don't know, different people are living in different locations watching this, but we're kind of back and forth, especially here locally. Some stores are very strict on what they'll allow. Some settings are very strict. Some settings are more, everybody can kind of do what they want. So I think we're in kind of an in-between stage where that's pretty hard. especially when we talk about like the certainty. People like knowing what it is that they can do. Some people are very strict, and even prior to pandemic, they wash their hands inside and outside the house, and stuff like that. And now it's been very hard to kind of latch on to a something. So I think it is potentially useful for people to have this is how I do it. And that's going to be kind of like my mini anchor within whatever is going on around me. So again, we're talking about non-clinical. So, people who are just, what do I do? And it's not to a crazy level. I think it's also important to figure out where you're going to get your information from. One of the biggest challenges I've seen, especially with couples work this year, is this really torn couples apart. It used to be kind of cute, like, okay, he reads the New York Times, she might get her information on Instagram, and it didn't make too much of a big difference. And this last year, between the pandemic and the overlap of a lot of the political related issues, that kind of divide has really kind of, I've seen, torn a lot of people apart. So leaving aside the couples component, I would just say for individually, I think it's important to be clear with yourself, like where I'm comfortable getting my information from. Do I want to get it from the CDC? Do I want to get it from my local health department, my own doctor, or my circle of friends, and kind of how I make sense of it? And keeping in mind that a lot of sources are just not fully consistent, and whether that's because the state of the science is in flux or whatever else might be going on, to kind of get clear with your own values and principles about your information. Just to tie, you asked about Emunah before. I think this does tie into it. We have this halachic idea of Shomer Pesayim Hashem, that Hashem will kind of keep you, whether individual or community, safe as long as you follow within a certain, realm of what's appropriate and acceptable. And I think it's important for people to get grounded for themselves in terms of, what's going to be my most reliable source of information, and then kind of putting it into place. I do think that people are more, on the whole, I think people are more accepting that I'm going to do my thing, you're going to do your thing. Maybe behind their backs, we talk about what the other person is doing. But I think openly, we're kind of like, okay, you don't want to touch me, like, that's okay. I'm not going to push it and call you a weirdo for that.
Okay, thank you. I'm actually going to follow up on something you just said, and I want to direct it towards Rebbetzin Blumenthal and Rabbi Sadiq. It's definitely much more of a public policy, and we're wrapping up. Rachie, I got one more good question for you, and then I'll give everyone a last chance to speak. But I don't know, Rebbetzin Blumenthal, Rabbi Sadiq, either one of you could take this first. But oftentimes when we're facing a threat or an enemy, it tends to unite people, right? You saw that after 9/11. You see that after the 3 boys were kidnapped and killed in Israel. There was a pervasive sense of unity amongst our communities. Unfortunately, the COVID pandemic has done the opposite, which is that it has created a prevailing polarization in our society. How do we isolate our children from the negative impact of that polarized society? How do we reinforce the values of our Revus? How do we make sure that the difference of opinions when it comes to our own personal feelings about COVID don't undermine the integrity of the unity of our community, which we work so hard to create?
I guess I'll start. I've seen this a lot just in my therapy, especially on the days where during the pandemic, when I was on Zoom and I went from like Republican to Democrat to Republican to Democrat, and they all want to know what I feel, and that's so not happening. My opinion just doesn't matter, which I guess is my philosophy a little bit as Rebbetzin also, because I want to make people feel comfortable to be able to speak their truth and what's going on with them. But to go back about the Arevus aspect and how to connect, I think if we just take that topic, because this is something very polarizing, and for some people, not everyone, they're so passionate about what they feel and believe in regards to these different issues regarding to COVID, it's hard for them to see beyond that. But I take it back to, if you're going to have someone at your house, let's say for a Shabbos meal or something of the nature, do you necessarily, before you cook, ask them if they have allergies? Yeah, you do. You want to make sure that they feel comfortable at your meal and they're okay with it. So you don't want to be killing them or hurting them if they're allergic to nuts, and suddenly you have to go get an EpiPen or, God forbid, ER. So the same kind of thing, I think we need to think about people's feelings about COVID, people's thinking about politics in general, but that's a pre-COVID kind of thing, is, hey, what are you guys comfortable with? Do you require masks? I really want to hang out with you. I want to get together with you again. I haven't seen you, but tell me what your comforts are, what your comforts are not, just so I know that I'm respectful when I'm around you. Because it's not about my choices and your choices is how can we be together where we're both in an environment that we're comfortable in? Because I miss people. I want to see people. And just because we disagree on different things, we've disagreed on things in the past always about all these different things. Just happens to be that this is the one we're facing right now that seems very relevant. But if we take out the now aspect and just think, how would you deal with it in a general level of having someone in your life, is just think, how do we make this work? And if you have that focus, not just, oh, I can't talk to that person, they're a Democrat. I can't talk to that person, they're like that idea, that will polarize you, that will isolate you from certain people. But if your goal is a rebus and to be with other people and to learn how to be with other people with different opinions, that's what tolerance is all about. It's not about sharing the same beliefs and sharing the same opinions. It's about being with others in the world, knowing that it's okay to disagree. Then we need to think about it like that. Like, what are your allergies? What are you comfortable with? And that's my guidance as to how to do it.
Rabbi Sadiq, how do we reinforce that in our communities?
I said this afternoon that when the Beit HaMikdash was destroyed, there were no cell phones or internet or anything like that. And it's like that teacher I said who gets angry at the class that says, I'm so upset with you. I'm not even telling you what you did wrong. Go in a room, sit down and figure it out. You figure out what was so terrible about today. Hashem didn't do that. He gave us the answer. He said, I could put up with shvichas damim. I could put up with gilui arayos. You could even bring an idol into my Beit HaMikdash. I'll handle it. I can't handle the fact that you don't get along with each other. For 2,000 years, we're trying to get it right. We're struggling with one thing that we were told. I will look away from everything else. Just figure out how to get along with each other. And when another tekufa comes like this, where this comes to light, and both sides have points. And when they ask me what side am I on, I said I'm on the side of making sure that the children are not distracted and they stay in school as many days as possible. That's my shita. That we shouldn't get them back on Zoom. I don't understand maybe all of the medical studies. Maybe I don't understand the politics behind it, but I understand that a child cannot be distracted, especially if the same parents are telling us, what are you doing for our children who are a year and a half behind in some subjects and struggling? So I said, in the same breath, you're telling me that you're so worried about your child being in a year and a half behind, and at the same time, your child has been sitting at your kitchen table and at every Shabbos table and everywhere else you're going, and you're all heated up and you're all bent out of shape on this subject for good reasons. I get it. But as to what we're doing in school, again, I look at us as a teva. When the kids come on here, we're just totally laser focused on them. And they're so happy to be back, so happy to see their friends. Masks are not being discussed here. Policies are not discussed amongst the kids. Last year, one of the kids came up to me and said, I want to apologize to you. I'm so sorry. I go, oh, I know my mom is driving you crazy about this mask. It doesn't really bother me. I'm really good with it. I don't know why my mom's not good with it, but I'm totally okay with it. And she's telling everybody, and he's suffering, and he can't breathe. And God forbid, I'm not talking about those kids who have allergies and they develop anxieties from it. Of course, there's some real stuff. There's real studies of what the mask has done. But this kid came up to me and said, on behalf of my mom, I'd like to apologize to you because I'm really dealing fine with it. My mom is not, so we have yet another opportunity where Hashem said, I just want you to get along. I want you to figure this out. 2,000 years later, we're still tripping over it. So it's a little bit disheartening, but in school, we have done everything we can to make sure that the kids are getting along, and they're just thrilled to be back, panim el panim, face to face, and hopefully we're going to have an amazing year.
Thank you for that. Mrs. Mirzoff, you and I were speaking a little bit today as we were preparing for this panel conversation. And one of the things that we spoke about is that such an emphasis and focus on COVID over the last year and a half. What haven't we been talking about? Every time that either a head of a school or a community leader or a therapist, or every time we have a conversation about COVID, we're not having a conversation about something else. And that there are other issues that are either facing our children, facing our communities, which are being ignored because we've been focusing so much on COVID. What are some of the conversations that we should and need to be having that are going and getting pushed under the radar because of such a focus on COVID?
So we spoke about it, but we didn't prepare with that question. I'm just saying out there for anyone who's listening. Yeah, so it's interesting because I kept thinking about my answer about technology, and I'm like shooting myself. I'm like, well, I was so I'm being honest here. I was so intense, and I was not validating to what the parents went through and what the kids went through. And, you know, Rav Weinberger, I know I told you this, Rabbi Moskowitz, today, but, you know, our family really loves Rav Weinberger. And he once said something that I really hold through. And he said, Klal Yisrael is fixing their tie while their pants are falling down. And I love it. I love it because I think what we tend to do as not just the Jewish community, but as human beings is we focus on something that takes our minds away from the bigger and more real things. COVID is extremely real and it's really plagued our whole world. But we lost ourselves. Like we lost so much of who we are. And my answer for the technology, just to go back, is because I once heard this amazing podcast from this woman named Dr. Becky, and she gives an amazing mashal. I mean, not a mashal, she's not Jewish.
So we were only allowed a reference behind the beamer here, just for the record.
Oh, she wasn't on it. I can't get her on it either.
She will be now.
So she's great. But she basically gave this mashal, and she said that imagine if you were, okay. Someone commented. Okay, imagine you're on an airplane and there's really terrible turbulence, like plane is going down. And the pilot gets on the plane and says, okay, everybody, I have lost control of the plane. Is there another pilot on the plane that could come to the front? How do you feel as a passenger? Feel awful and petrified. So imagine the pilot gets back on and says, okay, everybody, you need to be quiet. You are too loud and you are distracting me. Just be quiet. Shh. How do you feel as the passenger? You're more anxious. Why is my noise and my fears affecting the pilot? And imagine if the pilot gets back on the plane and says, guys, I can't. I'm done. Hands up. We're going down. You feel awful. What do you really want to hear the pilot say? You want the pilot to get on and say, listen, you guys are passengers. That's really scary for you. This is a really scary flight for you because there's so much turbulence because you're the passenger. As the pilot, I'm just letting you know I'm not scared. I'm not scared. I got you. I got you. And the reason that makes the passenger feel so much better is not because someone's in control for you, but they allow there to be meaning and structure around chaos. And I think what COVID did for us and the conversations around COVID was everything's so chaotic that I don't have structure or meaning, forget control over anything in my life. And everything's almost like a free-for-all. And we forgot almost our values. We forgot who we are, what we stand for, what our priorities are, what matters to us. And we should discuss COVID and I'm all for it. It would be a shame if we weren't recognizing that our pants were falling down and we lost a sense of who we are, what we represent, what our values are, what our mission is as a Jew, as a community, just because we're focusing on perfecting the tie. And I mean, is that a direct conversation? No, but I think we need to be pilots where we start to feel, I got you, like we got ourselves, we're back and we can stand strong for who we are and almost calm the rest of the world down with that.
Thank you for that. That was very powerful. Thank you. Rabbi Sadiq, what are the conversations that we as a community should be focusing on? If we're not focusing on, with all this time that we're going to have now, because we're not hawking about masks and we're going to really focus on what's important, what are the conversations that in your mind are most pressing that we need to be struggling and grappling with?
There are two things that are on my mind and been on my mind for the last 10 years, really worrying me. Number one, we have a real teacher crisis. I know everybody read Mishpacha's article, but I've been screaming about it from the top of the roof with a megaphone for 10 years. That while all the universities, their OT and PT and all these other programs are busting, their educational departments are decreasing where you can bar mitzvahs in those classes. I mean, it's just there are various reasons for it. This is not the time to go into why. It's beyond pay scales and packages and things like that. They're not going into this field. So I think we need to do everything possible to support our teachers and find ways to show them the beauty of this noble profession that truly changes lives. So I've been very involved with that with different organizations, and I think it's important for parents to know that I'm not an alarmist. I don't like to scare people, but we're headed, the next few years towards a place where, we're going to have beautiful buildings, but not great teachers to put in there. So that's at the center. Every ounce of energy that we have here, we're going to exert into mentoring and working with teachers and making sure that we have a school filled with amazing teachers. Second thing is even though Hashem created children resilient, I think that we need to do a better job as parents, including Yaakov Sadiq, first and foremost, because I may run schools well. I fall apart at home. Thank God for my wife. I don't do a good job at being making our own children resilient. I said this afternoon, poor parents get labels every year. Helicopter parents. Now this year they were called snowplow parents because they call teachers, they call principals. Every time a kid gets an 80, it's not acceptable. It comes from a good place. The world changed in a hurry, and the world got scary in a hurry. My mother had one rule for me: just get back before dark. That's it. I don't care where you're biking, where you're going, where you're playing stickball. Just get home before it got dark. And that's not our world today. So I think as parents, we mean well. We want to protect our children, but we're overprotecting them, and they're going out into the real world and they're falling apart. There's some real serious, and again, there's amazing health professionals here that probably know this better than me. The universities and colleges are reporting some scary statistics about suicides. And when they got to the bottom of it, these children don't know what to do when they get a B, because and I said this at the meet and greets, because what previously you can call anybody in school, and now mom can't call the dean of UCLA, so the child's got to figure this out by himself or by herself, and they don't know how to figure it out, and they're dropping courses left and right, and they're not giving it a week to. All these great companies are reporting that they're leaving jobs after 6-7 months because the minute they have an issue with a coworker, they just go for the next job, or they can't get along with their boss. They just say, we don't want to forget about this job. I'm going to go to the next job. So we're finding that our children are not coming into the world resilient. And as parents, again, myself at the forefront, if we can learn where to come in and where to come out, where to be the coach, and when to make the phone call, when not to make the phone call, and promote that they learn how to solve problems themselves, and and go up to the teacher and figure it out in the yard with the child. We're so quick to pick up the phone and call the school. It's been detrimental for the students because they're not resilient. So if you were to ask me, Rabbi, on those two fronts, we need amazing teachers because great schools are made of great teachers. And we need to make sure that, yes, they're born resilient, but we do our part to not only keep them resilient, but even make them more resilient so they're prepared for the world.
Thank you very much. We are wrapping up. I know it's the hour is late. And again, I want to thank each one of our presenters really for sharing, again, really their wisdom and their vulnerability here with all of us. And I know from the comments that are filtering in, people are really appreciating it. As a final question, again, you could take this in whatever direction you want, but we always say that there is some good in every bad. I was wondering if each of you could reflect upon some of the positive takeaways that you have experienced from the COVID era over the last year and a half. Dr. Winograd, we will start with you.
Sorry, you said positive experiences?
Positive, right. What are some of the positive things that we could take away from the COVID experience?
I think for me, it's family. The bulk of the clinical work I do is family therapy, especially with more serious mental health issues. It's amazing to see the way families have rallied this year. Personally, I really enjoyed the components in the BRS Weekly, where there's like families that have been highlighted, or the bar mitzvah, bat mitzvah, boys and girls talking about their family lives. It's just amazing to see that, people who, despite being on so much technology, have also really found ways to connect as families. It's cool to see how each family's kind of done their own thing. I've got to meet a lot of new family dogs. Like every family's got their own new thing that's happened. And my hope is that that continues, and it's getting back to the routines that we want to and need, but that we really find ways to make family matter too.
Excellent. Thank you. Rebbetzin Blumenthal.
And honestly, it's the same answer. On a personal level, like our home has always been about guests and developing things and helping with the shul and community and whatnot. And this really COVID made us slow down and not be so distracted and focus a little bit more on our own family and our own children, what we're developing in them. And sometimes I used to joke that I'm running a social skills group for my 3 children to actually get them to like each other, hopefully one day. And that was such a tough and fulfilling experience. Even just sitting Erev Shabbos and like picking out a toy or a new puzzle we're going to do or a new Lego we're going to buy because I'm going to be making it with them and sitting with them and not just, hey guys, help me clean your room before the guests come. It's like, that doesn't matter. What are we doing with our time? And they didn't have as much access to their friends. It was a lot of family time, which isn't always the easiest, but you don't have your iPads. The Shabbos was such a different animal. And I did miss, and I do like that I'm having guests again and whatnot, but family time with my kids, I think I always wanted it. And then it was shoved at me. So I wasn't ready. And then after experiencing it for the first couple of weeks, I leaned into it and it was great. It was really something I'm so grateful for. Still overwhelms me. If you tell me we're going back in that, I will still freak out. But I am grateful that it was forced upon me because I don't know if I would have recognized what they needed from me and my attention.
Excellent.
Like so it was great.
Mrs. Mirzoff.
Yeah. I agree with what everybody said. I think the best part about COVID was something that you actually touched upon, Rebbe Moskowitz, which was seeing everybody go through the same thing together. And maybe everybody felt it differently. Maybe COVID entered certain homes and not others. But I remember at the end of last year, we went around like saying our highs and lows, as a faculty. And I really was just so inspired, remembering that the teachers themselves were going through so much of their own personal things in terms of COVID, yet they still came to school every day, dressed with their utmost wisdom and giving it all over to our children who were also suffering with COVID. And I think part of COVID and going through it all together was really actually noticing people's true strengths and seeing where they really learned how to step up when needed to step up. And for those that couldn't, because it was too hard, aka me, recognizing that there are really strong people around you that you can ask for help. And I think that was really a special experience for me that I hope it continues way after COVID.
You mentioned asking for help. I'll just throw in a quick Dvar Torah as we come to the end and turn it over to Rabbi Sadiq. But I always found it interesting. I spoke about this one year that the imagery that we start for Kol Nidre is the Chazan is he has on both sides of him people carrying a Sefer Torah. And the imagery of that is obviously Moshe as he's sitting there with the battle of Amalek and he's got Yoshua and he's got people on both of his sides and they're uplifting him. They're helping him up, right? Every time his hands fall, they help lift his hands up. And that's the imagery that we start Kol Nidre, not of a Chazan up there alone, but a Chazan up there that's being supported by the entire community. And I spoke that year and it's exactly what you just said, is it's very much an Elul idea. Is not to focus on what I can do by myself and how I can get through it alone, but it's how can I reach out and help other people and how can other people help me, right? If I'm trying to change a habit, if I'm trying to break a bad habit, if I'm trying to let me reach out to a friend, find a chavrusa, speak to someone. I've been really trying to crack this habit for many years. Do you have any suggestions? How can you hold me accountable? How are you going to make sure that I'm following through on becoming the best version of myself? So you're right. It's not just about going through it alone, but it's about creating a supportive environment where we're helping each other. Rabbi Sadiq, some of the positive benefits of the COVID era.
Well, besides what I mentioned before, that, children started riding bikes. All my 5 children learned to play an instrument during COVID, all 5. Incredible. I've been trying for 10 years. I can't do it.
What's yours? What instrument did you learn?
I said, except me, my 2 kids did. I just keep giving up. So anyway, besides all those things, I think Hakar Tov, appreciation. I remember flipping out when Pesach was coming and figuring out, how do I get a haircut? Everybody's on shutdown. I don't know what to do. So I went to Target and I bought all the machines and clippers and all that. And let's just say, thank God we were in Bidud and nobody saw me. So I started appreciating my barber. Like, before that I was like, yeah, all right, you're a barber and you're a nice guy, and thank God. But just the simple things. I still can't get a car. I mean, these chips, I don't know where they are, who has them, on what ship they are, and what embargo. I don't understand it. All I know is I can't get a car. So if they see me in my spot on a motorcycle next month, again, we started really appreciating the things that we were taking for granted. That's something that I took away.
Thank you. Thank you each very, very much. And again, I want to wrap this up just by, again, thanking each of our panelists for sharing their wisdom and their time and their advice. And again, for sometimes being vulnerable and sharing from your own personal experience. I know even for me, as the moderator here, I found it very validating when some of you said something and I said, hey, that's me. Like Rabbi Sadiq, it's a miracle that my marriage lasted, the haircuts over COVID. I mean, it really was. I don't think anyone was waiting for the barber to come back into my life more than my wife. But even little tidbits like that really validated a lot of the emotions that so many of us have been feeling throughout COVID. You each provided us with very helpful tips, very helpful pieces of guidance. And again, I want to thank you very much. And my bracha is that we should, as a community, should continue to inspire each other. We should continue to improve as a community. We should continue to grow. And please, God, come before Hashem on Rosh Hashanah, not as individuals, but where the whole is always going to be greater than the sum of the individual parts. And with that, we should all have a ksiva v'chasima tova. I want to wish every one of you a good, happy, healthy New Year. And until next time, stay happy, stay healthy, and stay holy.
Thank you for arranging this, Rabbi.
Thank you.
Thank you.